idea of our study was to analyze the obesity in patients enrolled in a clinical trial, in a randomized clinical trial. As I work in Brussels in the Julius Borde Institute, you have a good opportunity of work in close collaboration with the Breast International Group, and you are responsible for some clinical trials, and you are responsible for the database. This was a unique opportunity for us. The original clinical trial was a trial comparing 4 arms, 2 with anthracycline-based chemotherapy followed by CMF, and 2 with docetaxel-based chemotherapy followed by CMF. These results of the trial they were published beginning of this year in the journal National Cancer Institute regarding the general population. So why did you decide to analyze those patients? We thought that obesity is a very important issue, is really a health problem. There is an increasing incidence of obesity worldwide, and patients with cancer, and if they are obese, they die much younger. We also know that patients are not well treated if they are obese. Most of the protocols, they limit the chemotherapy to a body surface area of 2.0, and this is not adequate chemotherapy dose. Sometimes they are undertreated. And most of the studies published about this result, they do not have a reliable type of treatment. We don't know exactly which type of chemotherapy they receive. We don't know the dose of chemotherapy. So having this database was important for us. The proposal was to evaluate the effect of body mass index, BMI, on disease-free survival and overall survival in these patients. Almost 3,000 patients enrolled in this randomized trial. So we performed a retrospective analysis of 2087. All patients were node-positive early breast cancer. And we evaluate the disease-free survival, overall survival, comparing these 2 regimes. BMI was obtained in the beginning, in the randomization of patients before the first cycle of chemotherapy, and we define obesity according to the WHO criteria, BMI greater or equal than 30. And then we perform the analysis. So we had in our population almost 20%, 19% exactly, were obese at baseline, and our median follow-up was 62 months. When you look at the disease-free survival, we can see that obese patients, they have a worse disease-free survival, meaning that the breast cancer recurs more often and more faster. And if you look into the overall survival, obese patients, they live less. The overall survival is not so long as the obese patients. They have 48% more risk of dying. If you look into the docetaxel versus non-docetaxel, it appears that there is a difference in obese patients, especially for survival. But the numbers are very small, and we will still analyze this data. If you look into outcomes, disease-free survival, overall survival in different subgroups, almost all have a worse disease-free survival, overall survival, and there is a significant, statistical significant difference for younger patients, but this may be by chance. We know that most of our obese patients, they were postmenopausal, and at baseline they had cardiac disease and much more diabetes. If you look into this curve, this is the survival, overall survival curve of obese patients. They live less than non-obese. They die earlier. So in this study, obesity was associated with a poor disease-free survival, overall survival in node-positive breast cancer. We looked into the chemotherapy dose. Most all patients, they had at least 95% of the cumulative and dose intensity, so they were treated adequately. And the problem is, given the increasing prevalence of obesity worldwide, we need to improve our research in this patient population.